After 30 years in emergency response healthcare, there's a reason why I break out in a sweat every time I pull out my table saw. I see a lot of bad hand injuries with table saws. Dr. John with InstaDoc.health. I want to talk about hand lacerations in general right now. Some of them are pretty obvious, they need help. You get some pretty hairy looking hand injuries where the table, you can see where the saw actually went right into the bone on someone's hand. But it turns out that most hand lacerations really don't need much care. So when a laceration on the hand is less than 1 inch in length and it doesn't splay wide open, it turns out that if you put stitches in it or not, it doesn't seem to make much of a difference in how it looks and how it heals or any of those other things. There's a lot of people getting stitches on their hands that probably didn't actually need to get it. I put an oyster knife through my hand a few years ago. I washed it out, I put some stitches in it in my kitchen, as one does. And after a day, the stitches were so annoying, I just took them out. You really can't see the scar on my hand anymore, and it was a pretty good one. It just goes to show that those lacerations, they heal really well. The hand is really good at healing. You just got to make sure you wash it out. Infection's a real risk. The real thing you really want to know is, did you cut a tendon? If you fully cut a tendon, you'll see that your finger won't work anymore. You'll just see it won't move. A partial tendon, it'll hurt when you try to move it against resistance. That's kind of tough because you just cut yourself, so of course it hurts. It's really hard to tell a partial tendon laceration versus just no tendon lacerations. When in doubt, we always splint. I will send all my actual tendon lacerations to a hand surgeon. I will sew that wound up, wash it out really well, sew it up if it's big enough. I'll have it sent to a hand surgeon. Within a week or so, is going to have to do probably surgery to repair that tendon and make sure it attaches well. If you wait too long, you will lose function though.